Anytime a friend or loved one is hurt, our first instinct is to help. In the United States alone, it is said that every 40 seconds, one American will have a heart attack. It is best to be prepared, so I strongly encourage all of you to learn this life-saving skill. This is Chris. His heart has stopped beating. Today, I'll be demonstrating to you a very basic, hands-only CPR. But first, I must tell you that I am in no way licensed to train any of you in CPR. This is merely a demonstration and in no way a formal class. I will, however, give you information on how to become properly certified later on. While on a walk with Chris, he passed out, and I remained calm because I knew exactly how to handle a situation like this. The first thing you want to do when someone has collapsed is to call 911 and report this right away. Hello, my buddy Chris, he passed out. Yes, I know CPR. Please hurry. On that note, if someone else is with you at the time, have them call 911 so you can begin to assess Chris faster. Remember, seconds count. The sooner that CPR started, the chances of Chris's survival go up. For every minute that CPR is not done, Chris's chances of survival go down by 10%. Even in a situation where this is something minor, such as getting lightheaded and passing out, calling an ambulance could help prevent these things from happening in the future. Now, let's help Chris until our paramedics arrive. The first thing we want to do is check Chris' level of responsiveness. We don't perform CPR on him if he doesn't need it and will wake up. To check for responsiveness, we can shake him, yell at him, and slap him even just to see if we get any sort of response or reaction, like this. Chris, are you okay? Can you hear me? It looks like you get no response to Chris. So now we need to check for a pulse. To check for a pulse or heartbeat, we will use our index finger and middle finger together on the side of our neck under the angle of your jaw. While keeping light pressure, feel for any pulsating for about 5 to 10 seconds. I did not find a pulse on Chris, so now it is time to start CPR. CPR is broken down into 3 basic steps, and the easiest way to remember these steps is to think of the acronym CAB. Step 1 of the CAB procedure is chest compressions. Before you can start chest compressions, it is important to have proper hand form and placement. For correct hand placement, feel the chest for the breastbone, otherwise known as the sternum. You want your hands to be right in the middle of the sternum when starting chest compressions. For correct hand form, take your dominant hand, palm out away from you. Next, take your non-dominant hand behind the first hand and interlock your fingers from behind. While doing chest compressions, you want to push the chest down 2 inches. It is recommended by numerous medical professionals to push the chest down 2 inches to maximize chances of successfully manually pumping the heart. When doing chest compressions, you want to do 100 in a minute, or 10 for every 6 seconds. A good tip for staying in rhythm while doing chest compressions is to think of the song Staying Alive by the Bee Gees. Ha, 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 stay alive, stay alive. Karaoke's on Saturdays, guys. It's pretty great. After you do 30 chest compressions, it is now time for the second step of the CAB procedure, checking the airway. Checking the airway simply means to make sure that his windpipe is open and clear of anything that could block it. And to do this, we are going to use something known as the head tilt chin lift technique, which you take one hand and place it on his forehead, and with the other hand, using our index finger and middle finger together underneath the chin, we will push down on the forehead and up on the chin to open up his windpipe and allow for the easiest breaths possible. And now we will listen to see if Chris is breathing with one ear while simultaneously placing one hand on his chest to feel if it rises or falls. Since Chris has no pulse and is not breathing, we need to move on to the very last step of the CAB procedure, which stands for breathing. Before we can breathe for Chris, we need to make sure to use the head tilt chin lift technique to open up his windpipe and allow for the easiest breaths possible. Before giving Chris the breath of life, we need to make sure to pinch off the nose. The reason we pinch off the nose is so the air will go down into his lungs and will not escape straight through his nose when we breathe. After 30 chest compressions, we'll give 2 breaths. You'll breathe until we can see his chest rise, we'll let it fall again, 1 more breath, and let it fall again. After 30 chest compressions, 2 breaths. 30 chest compressions, and then 2 breaths. And then, you guessed it, 30 chest compressions and 2 breaths, in a continuous cycle. It is important to note, however, that this may be tiresome for one person, and you may have to do this in shifts. If there's someone else with you at the time and they don't know CPR, you could quickly show them how to do this and you can do this in shifts or as a tag team. In review, first, call 911. Then, check for responsiveness. After that, look for a pulse. If there's no pulse, start CPR, which is broken down into CAV, chest compressions, airway, and finally breathing. By the time that I finish the speech, roughly 15 Americans will have had a heart attack, and I'd like together we can save as many people as possible. For more information on how to become CPR certified, please visit www.heart.org. I have copies available if anyone would like one.